What?
Okay,
Okay,
the
so we
Braintree,
are recording.
okay, we're all set?
Yes?
The Braintree Board of Health meeting will now come to order via a Zoom meeting, November 5th, 2020 at 7 PM. Present, Department of Municipal Licenses and Inspections Director, Mary Beth McGrath. Dr. Philip Nettleman, Vice Chairman on the Board of Health, and Dr. Arthur Bergoli, Chairman for the Board of Health. Board of Health meeting agenda, November 5th, 2020, 2 pages. Approval of minutes, September 17th, 2020, 2 pages.
I
Philip,
move
if you'd-
they be approved.
I'll second that motion.
So
All in favor, aye.
so I just need to get a roll call from you. So Dr. Nettleman,
Yes,
Dr. Bergoli.
Yes.
Okay.
New business. Oh, I'm sorry. List of complaints received September 15th, 2020 through November 2nd, 2020. Mary Beth will discuss.
Yes, so the majority, I would say probably 98% of our complaints that are coming in now are all COVID-19 reopening related. And they would be, majority are face masks and social distancing in establishments. So it's a matter of the staff members are assigned to go in to whatever the establishment might be, whether it be food establishment or any other type of business, because it's anything. And we do a follow-up investigation. If a violation of the COVID-19 reopening requirements and whatever the business is, whether it be retail, whether it be food, whatever it might be, a health club or whatever, then if a violation is observed, then we have to follow what's called progressive enforcement. Progressive enforcement starts with a written verbal warning. And then from there, if we continue to find violations, it goes to a written warning and then a monetary fine, and it could end up in closure of the establishment if the violation continues. We've only had to do that once in the 9 months, is have it progressed to a closure of an establishment. So that's definitely not the goal. But if the violation is so blatant egregious that they continue to do it, we don't have any choice. So
Right,
what's
these aren't-
the latest? What are the latest recommendations or hours or closures?
So the governor came out with 3 mandates earlier this week, one being that face masks are required for all persons indoors and outdoors that are over the age of 5. And outdoors means that if you're within 6 foot if you're within 6 foot of another individual that's unrelated in the household to you, then they have to wear a face covering. The second mandate is for limitation on gathering sizes, which would be no more than 10 unrelated persons going to a gathering in a private residence. So if they're not part of that household, that would be considered some of the numbers in the 10. Also for gatherings outside at a private residence, no more than 25 unrelated household members. For indoors in a public setting, no more than 25 people must social distance and wear face coverings, and then it continues on. And the last order that the governor issued earlier in the week was that business establishments are required to close at 9:30 p.m. every evening. And for restaurants, they will have to close their doors for patrons to be able to come in and sit down, but they will still be allowed to offer takeout and delivery only.
You'll be able to finish your meal?
So if you're in the establishment at 9:15 and you're finishing your meal, then you will be allowed to finish your meal. They just won't be allowed to let anyone else into the establishment to sit in the dining room and dine.
Gotcha.
So those orders become effective tomorrow morning, November 6th at 12:01 a.m.
And that's 9:30 p.m. they have to close?
Yes. So they have to close and they are not allowed to reopen until 5 a.m. And there is also an advisory that the governor issued for persons to stay at home between 10 p.m. and 5 a.m. So stay in your residences, unless for some reason it was an essential service you have to work, or you have to have an emergency that you have to attend to. But that's an advisory. The other 3 are mandated orders.
What about bars?
Standalone bars are not allowed to open in this phase. The only way that an establishment can offer alcohol is if they provide food with it. It has to be accompanied by food.
Okay.
Now,
Thank you.
as far as the closure of establishments, for example, restaurants, after 9:30 PM, they cannot offer alcohol at all. They cannot sell it. They cannot offer it as a takeout. The only thing that they're allowed to offer in a takeout or delivery service is a food item.
Really?
Mhm.
I know.
Not even beer?
No,
Okay.
for a restaurant.
I'll
Yeah.
keep my thoughts about this to myself.
I'm sure you will.
I
You're
will.
smart. Okay, thank you.
Now, I do believe we have
Thank you, Mary Beth.
Christine Yarborough on the meeting. She just popped in. So, and she would be listed as the item number 1A on the agenda.
Yep. New business. 1, request for keeping of animals permit. A. Christine Yarbrow, 94 Brow Avenue, 10 chickens, application and supporting documentation, 18 pages plus regulation, 3 pages. Mary Beth.
So in your packet, you have the entire packet that Ms. Yarborough provided to the department to support her request for a keeping of chickens permit. And about the second page in provides a narrative of why she is interested in keeping chickens on the property. And then the third page in, you'll see the area map of where exactly her property is located in relation to Brow Ave and Tremont Street and Academy Street. Fourth page in are the setbacks of where the proposed coop will be in relation to a driveway that kind of wraps around the back of the property. So it is, the coop will be 25 foot off, greater than 25 foot off the rear property line and the right sided property line, and 20 feet off the left side of property line. So it clearly exceeds what the board has asked for in the past of 10 feet. And Ms. Yarborough is requesting the keeping of 10 chickens. She has made notification to all of her direct butters, and we have received the certified mailing cards back that they did receive the notification. And she is, as I mentioned, on the line to offer more information to the board members.
I think this is one of the, I'm blanking now on the word, on this notification to abutters, is probably the finest letter I have read in all my years. It explains every process and what's going to be done with everything. I have no questions.
Thank you.
And there are 4 butters and we have letters on everyone, correct?
Yeah. Yes. Now, I just wanted to make mention, Ms. Yarborough, if Amy from my office hasn't already, the board, if they do approve this request, which it looks like they will, that is only for chickens. You are not allowed to have any roosters on the property.
Yes, she did mention that, and I don't want to have roosters on the property.
Thank you.
I'm sure those neighbors don't either.
Right, I don't want to be woken up by that either. Yes. Very good, thank you.
It looks like a nice chicken coop. And how many children do you have?
I have 2 college-age children.
Who will be cleaning out or taking care of the chickens? I
That will
see
be-
the one boy.
Yeah, all me.
Oh, you, okay. All right.
So one thing that
Very
the board
good. All
members-
right.
So one thing, Ms. Yarborough, that the board members have always been keenly aware of is that sometimes the keeping of animals such as chickens does tend to attract wildlife. And so you'd make mention in your permit application about that. And one thing that they normally would ask is that on the chicken coop and run, that when you have the fence wiring, that it be buried into the ground so that animals cannot get under.
Yes,
I
dig
mean,
under.
they'd have to go out of their way to try and get into the coop.
Yes, yes, absolutely.
Okay, you want to take a vote, Mary Beth?
That's up to the board members.
I say fine.
Motion to approve Christine Yarbrough, keeping of 10 chickens at 94 Brow Avenue. Motion approved.
So Dr. Nettleman made a motion and you're gonna,
Nettleman made it. I'm losing it tonight. Dr. Nettleman made a motion. I'll second that motion.
okay,
in
and I
favor?
just need,
Aye.
go ahead. And the
I
roll call-
approve. I approve.
Roll call, Dr. Nettleman,
I approve.
Dr. Bergoli.
Yes.
So
Good
you're all
luck.
set, Christine, Amy will be in touch with you with the permit, so that will be issued tomorrow.
Okay, excellent. Thank you very much.
Okay,
Thank you.
bye-bye.
Good luck.
B, Matthew McGinnis, 26 Davis Road, 8 chickens. Application and supporting documentation, 11 pages, plus regulation, 3 pages.
Mhm.
Mary Beth.
So I think about the
Perfect.
fifth page in, 1, 2, 3, 4. The fifth page in is the area map of where the property is located in relation to Davis Road, Fallon Circle, and Calvin Street. The
Yep.
fourth page in shows the setbacks. And again, this one is in excess of 20, the coop would be in excess of 25 feet from the house and greater than 25 feet to the side and rear property lines. The property owner, Mr. McGinnis, has notified all of the direct abutters of his intention to keep the chickens or request a permit to keep the chickens. And we have received notification back from them.
That was
Yeah.
my question.
Yeah,
I saw, 36 Davis, 16 Davis, and then there were 3, 25, 15, and 19 Calvin. But I only saw 4 letters.
No, there's 5 there, Arthur.
Is there 5? My mistake then.
Yeah,
right. So, but the interesting thing is 26 Davis Road, 1, 2, 3, that really only has 3 abutters. It's one to each of the sides and then the rear. But
Oh, so you're not counting 25 and 19?
see, I'm counting, let's see, 25, 36, and 15 Calvin is what I counted as the,
what about 19 and 16?
well, I mean, he went ahead and did that because it looked like the very tip corners of the property would touch there. So he went ahead and notified them.
Yes, and they're all there. There's 5 there and they're all approved.
Yeah. So we have one from 25 Calvin, we have 36 Davis. We have 16 Davis, 15 Calvin.
I move it be approved.
I'll second that motion. All in favor, aye. Just that I
Aye.
didn't see the 19.
You
Okay.
actually, matter of fact, you read about that.
What? I didn't hear that.
No, I think that would be Fallon, I'm guessing Fallon Circle. I'll have to look into that one.
All right, but assuming everyone is fine, we
Yeah.
have no objections.
Okay. And I just need a roll call. So Dr. Nettleman made the motion, Dr. Bergoli seconded it, and I need the roll call. Yes, Dr. Nettleman?
Yes, ma'am.
Dr. Bergoli?
Yes.
Thank you.
Number 2, request for variance of lifeguard provision A, Residence Inn by Marriott, 180 Forbes Road, variance request 1 page, plus regulation 1 page.
Okay, so these are a little bit different this year than you've seen in the past. They are renewals for Residence Inn, Hampton Inn, and Riverbend condos. So Residence Inn and Hampton Inn both have indoor swimming pools as part of their hotel complex. And they, for the past several years, Residence Inn is the newer one, having opened about 2 years ago, has requested a renewal of their variance. They have not been in operation since February. I mean, when COVID hit and things were shut down, the pool had to close down. And they've chosen, when the pools were allowed to reopen in July, they have chosen not to reopen their pool at this point. So they're forward thinking that hopefully we'll get through this and they can make a decision as a corporation to reopen the pool. It is their decision not to open the pool. If they open the pool, they have to follow not only the requirements for swimming pools to be able to operate, the chemicals, the safety, but they also have to follow COVID requirements. So that's why they've chosen not to open, which is why you don't have any data as part of the application, because they don't have any data from February moving forward, because the pool's been closed.
If they chose to reopen, they would have to notify you.
Yes, because we'd have to re-inspect it for not only the operational requirements for the swimming pool code, but we also have to make sure that they meet the reopening requirements for COVID safety standards.
But they know that.
Yes,
Okay.
they were allowed to, by the state requirements for COVID, reopen in July. They've chosen as a corporation not to open.
Okay.
But they're hoping in the future things will improve, and that would allow them, they would feel more comfortable to be able to open. They just don't have the staff to continue to monitor the pool area and meeting all the COVID safety requirements, because they're pretty strict.
Okay.
So we're not.
You're approving a request for the variance of the lifeguard provision as you have in the past. And they're putting this in because their lifeguard variance normally runs from January 1st to December 31st of
I
each
see,
year.
okay, my mistake, okay.
Right, so they're wanting to make sure that they have it in place, should they make the decision to move forward and open.
And that's all three of them.
That would be all three of them. Now Hampton Inn also, their lifeguard variance goes from January 1st to December 31st each year. Because they're an annual swimming pool. However, Riverbend Condominium Association, they normally only operate from May 31st until around Labor Day each year. It's a seasonal outdoor pool. And again, they as well, all three pools chose not to reopen themselves when the governor declared that they could reopen in July. They just didn't feel that they had enough staff or the safety requirements be met for them to move forward.
Okay,
You'll
So-
you'll let us know if they come forward to you to open up?
Yeah, I can
Yeah.
let you know if we do end up permitted, we're going to issue a permit to them anyways, because we want to make sure the permit's in place. But before they can actually open to their patrons and the members and the public, we need to inspect the pools for, the chemical safety, make sure all the safety equipment's there, et cetera, and they know that.
Very good.
So if you're gonna I'm gonna need you to take votes on them individually. but-
individually, okay.
Yes. But it's the same information for basically all of them. I don't have, as you can see, Hampton Inn provided some data, but it was only for the first 2 months and then they shut down.
Okay,
Okay, Arthur, I would then approve, first of all, the Hampton Inn.
resident,
pool.
I'm sorry, Residence Inn by Marriott is our first one.
And so
I
Dr.
approve.
Norman, you made a motion?
You
I
made a
approve.
motion. I'll second that. All in favor? Aye.
And roll
Aye.
call, Dr. Nettleman,
Yes,
Dr. Bergoli?
Yes.
Okay,
B,
next one is-
Hampton Inn, 215 Wood Road. Dr. Nettleman, do you have a motion to approve?
I do approve.
I'll second that. All in favor? Aye.
and a roll call, Dr. Nettleman,
Yes,
Dr. Bergoli?
Yes. And C, Riverbend Condominium Trust, 399 Pond Street. Dr. Philip Nettleman, do you have a motion to approve?
I do have a motion to approve.
I'll second that motion. All in favor? Aye.
Aye.
And a roll call, Dr. Nettleman,
Yes, I approve.
Dr. Bergoli?
Yes.
Okay, thank you.
A lot of roll calls.
I know. Well, we're doing Zoom meetings. And that's why we're doing it, because of the Zoom meeting.
Gotcha.
So I don't have any other information for you other than just to update you, we have had some very successful flu clinics. Our first flu clinic of October 4th, we administered 807 vaccine. And Dr. Bergoli was there, so he knows it was a marathon. of
My wrist is still sore.
Now,
The
Dr.
carpal
Nettleman
tunnel
was-
has just about gone away.
Dr. Nettleman was lucky enough to be one of our first clients, as well as Mrs. Nettleman, around 8 o'clock Sunday morning.
Next
he-
time I wish I could have given him the shot.
I bet you do.
It didn't hurt at all.
Well, that's good to know. So then the next clinic was the following week, October 13th, and we administered I think it was around 350 vaccine, which
Wow.
was very good. We have since been every Thursday afternoon from 3 to 4 offering it in the building, in the town hall, in one of our meeting rooms to the general public wants to come and receive the vaccine for anyone that still needs it. So we'll continue to do that as long as we have vaccine. We've also administered close to over 900 doses of vaccine to our students I believe it's almost 900. I'm not, don't quote me on that number, but we vaccinated quite a number of Braintree Public School students in the school system.
Have you ordered the same, well, how much have you ordered in the last, say, 4 or 5 years each year?
So initially, probably between the last 3 to 5 years, we've normally ordered around 1,200 doses. Last year, we bumped it up to over 1,300 doses. And this year, for some reason, I just was thinking, because we went through all of our vaccine last year, I thought maybe we should, not even knowing COVID was going to be out there and this concern, thought that it might be best to order around 1,500 doses, which is what we did. So I'm glad we thought to do that. But the nice thing about we are gold members with Sanofi Pasteur because we've been with them for so long that if we don't use 25% of our vaccine, they will buy it back from us. So we're not going to lose it. You know, we won't lose the money on it because they'll buy it back from us.
Wow.
So the drugstores haven't made any significant impact on what you've done on a yearly basis.
Well, that's where we try and schedule our flu clinics as early as we can because we are in competition with the pharmacies. So as early as we
They
get,
start in August, though.
I know they do, but we have a faithful following. I'll say that.
Okay.
And I think everyone was very pleased with the outdoor clinic. We were able to, we were surveying people as they were going through the registration line, and no person had to wait more than 15 minutes between waiting in line, registering, and being vaccinated, which we think is a really good time frame.
No, it was.
Do you have something in place for COVID? If
Well,
and when
We
it
don't
becomes
yet.
available?
We haven't been given any guidelines from the state, but our outdoor clinic that we offered is a very good start to us being able to formulate and set up an outdoor clinic that can accommodate a lot of people. Because the
Okay.
state's pushing for outdoor clinics.
Okay. Very good.
I have to say, that was an awful lot of, Philip, I couldn't talk as much as I used to at those
No, it
clinics.
was
I was
busy.
all business.
We never
right,
stopped from the time we opened until we closed at
Yeah.
1:30.
Yeah.
Mary Beth,
Yes.
why don't you bring Dr. Bergoli up to date on the forms that I signed off
Yeah.
on for the
So-
school?
As you know, Dr. Bergoli, Dr. Nettleman is the town physician and the school physician.
Yes.
So some of the things that have just come out from DESE, which is the Department of Early and Secondary Education, or excuse me, Elementary and Secondary Education, is called the Abbott Binax Now. And it's a COVID-19 test that will be offered at the state level to school districts throughout the Commonwealth, in which they would be able to offer, it's like a rapid test that they'd be able to offer to students in the school setting, as opposed to having to send them out, you know.
Right, to the local clinic.
Right.
Whatever.
So this may
15
also
15
require,
minutes,
yeah.
15
So-
minutes, and it is not a PCR.
No, it's
Yes.
not a PCR, it's a rapid test. So they may have to follow it up if there's some concerns with a PCR test, but they're going to, I don't know when they're going to be rolling that out, but when they do, prior to that, Dr. Nettleman will receive the standing orders that he'll review for signature.
Right. Now, will those be done by the nurse? Administered
Yes,
by the
it will be
nurse?
done by the school nurses. Yep.
Gotcha.
So
Okay.
that's why the standing orders would be in place. Dr. Nettleman will review and complete the standing orders, signing authorization for the school nurses to be able to do it. And we're happy to assist the school nurses.
And it includes protective gear for the nurses, ventilators and things like that, that they have to use when they take the tests. So it's all inclusive. The only thing it doesn't include is, and I talked to Mary Beth about this, is it's difficult to imagine that the nurse is going to just arbitrarily do a test on a 10 or 12-year-old boy without getting the consent from the parents. So that's got to be included in there.
Right. So, I mean, certainly before you're doing anything like that, parental consent or guardian permission, consent would have to be provided. And certainly,
Okay.
as part of the standing order, Dr. Nettleman can require that if he's providing a standing order and signing it, that this would be one of the requirements.
That's all I have to say.
And as far as COVID on our end, you see the reports that I send you every day. As of today, we're up to 1,191 cases cumulatively since February of 2020. Jean did a really nice survey over the last, early on in COVID, from March 1st until the end of May 31st, the majority of our cases were seen in long-term care and assisted living facilities.
Right.
Well, when June hit, that flipped. So in June, we were up to over 70% that were in the community, and then less than 30 in the long-term care. And then July, August, 97% in the community and 3% in the residential, or excuse me, in long-term care. The same going into September and October, 97%, give or take, in the community and less than 3% in long-term care. So you can see where it went from one to a complete flip to the community. And some of those areas of spread of late have been associated with hockey, which, as you know, hockey was shut down. The rinks were shut down by the governor. And gatherings, large gatherings that maybe have been occurring, parties and things like that occurring in different communities that have impacted our community.
And
Thank you.
Which is probably one of the reasons the governor implemented a limitation on gatherings, face covering requirements, because even though Dr. Bergoli may disagree with this, the science does tell us that 80% of COVID spread can be reduced with the use of face coverings.
I hear you there. It's just that with the increase in the young population, why do we have to kill the restaurants? But that's a point for another day.
Well, you know, I mean,
I know.
you know, I'm sure it was not an easy decision
Here's
for the
to you,
governor.
Arthur.
Thank you,
That was a
fella.
glass of water. I'm sure that was not
No,
an easy decision.
No,
for
it's
the governor, but-
Crown Royal Black.
Right, seeing the increase in spread and making sure that people are abiding by and listening to the
Right.
requirements. I'm sure it was a difficult decision because he has to weigh the economic factor with the public health factor.
No, I hear you loud and clear.
And I will
Okay.
tell you that if you, in following the reports, our youngest case came in last week as a 1-year-old, or within the last 2 weeks as a 1-year-old. So that's the youngest case that we've had. The oldest case was 103.
And did
Okay.
well, survived fine.
Right, no, well, unfortunately, the 103-year-old did not,
Too bad.
so. But
Okay.
you can
well-
see
Okay.
it's a huge age gamut.
Well, thank you. Nice to see you, Philip.
Take care. Be safe in the office, Arthur.
Thank you. Would you like to put forth a motion?
I make a motion the meeting be adjourned.
I'll second that motion. All in favor? Aye. Do we need to do a roll
Aye.
call on that, Mary Beth?
Yes. Dr. Nettleman,
Yes.
Dr. Bergoli,
Yes, and I'll miss you guys for a month.
where are you going?
Okay.
Nowhere. I'll see you in a
Oh,
month.
Okay, well, I
See you
want to
at
wish you both a happy Thanksgiving.
Thank you, you
Yes,
too. And remember,
Thank you.
10
No.
people only.
10 people only.
I
Dr.
won't look in
Bergoli,
your,
that
I
means
won't
you.
look in your window if you don't look in our window.
That means you, Dr. Bergoli.
Okay.
And,
Okay,
and same to you, Arthur and
Thank you,
Mary
you
Beth.
too.
thank you.
All right,
Okay,
bye-bye.
You're welcome.
Thank you, Stephen.
Bye-bye.
Bye, guys.